calling the Health Committee to order this morning, January 5th, 2021, at 9 a.m. Amanda, would you call roll, please?
Barr,
Here.
Kokenauer,
Here.
Curtis,
Here.
Doobie, here, Zumwalt,
Present.
Awful,
Here. All right, may I have a motion to approve the agenda? Second? All in favor, say aye.
Aye.
Opposed? Motion carries. Let's look over the claims. You should have received them in the email. If not, do we have a copy of them? Has everyone received it and looked it over? All right, may I have a motion to approve the claims?
So made.
Okay, second.
I'll second it.
All right, would you call the roll, please?
Barr,
Yes.
Kokenauer,
Yes.
Curtis,
Yes.
Doobie,
Yes.
Zumwalt,
Yes.
Awful,
Yes. All right, do we have any public comments today? Seeing none. Dr. Youssef, are you ready for your report?
Yes, ma'am. So good morning, everybody. Last month we received 4 dogs, 2 cats, 3 bats. We sent it to the lab, and thanks God, so far we have negative cases for rabies. So we don't have any problem with the rabies vaccine, and that's all I have.
Any question for Dr. Youssef today? Thank you for your time. Today we have Eric Beatty in place of Beatty. Sorry, Beatty.
I won't tell her that.
Showing my age.
All right, before you see our normal monthly report, a couple things to point out. We're giving out 50 childhood immunizations, 44 through the VFC program, and 6 through PP. We're still, and I'd like to point out, we're still doing vaccinations. We trimmed down our schedule to make sure that there's adequate spacing between clients, and vaccinations are done by schedule only. So no walk-ins, they schedule an appointment with us, we get them out, we get them time-wise, distance enough, and we're able to safely vaccinate people because we want to make sure that we're continually vaccinating for our normal things. And reportable communicable diseases, we've had 3 animal bites, 2 dogs, 1 cat. We've had 7 rabies tests done, you see comments on that. 1 negative cat and 6 negative bats. The bats are quite active in the month of December. Don't know what that's about. And dipping into COVID, we've had 631 cases in the month of December. 530 were confirmed, 101 were probable. We had 0 new outbreaks in the month of December. But we do have 5 current ones that started likely in November and are just continuing on up until right now. And we did a number of press releases, 18 just because we're doing normal, nearly daily press releases, except for weekends and holidays concerning COVID-19. I'd like to give you all a moment to review the normal report, and then I can present more about COVID. If you have any questions, please ask. I should point out on the first page underneath food sanitation permits issued 151, and that's because of our annual food permit applications come in December, and we get them issued. I don't know how many we have outstanding, if any at all. The last week of December, we put out a siren alert, a robocall, basically, informing those that had not turned in an application and agreed, hey, you need to do this by December 31st, or else there's a late fee. So that usually gets last minute people in. Yes, sir.
There's few places that are serving meals dine-in. What about the wait staff if they're not wearing masks?
According to the governor's executive orders, all the employees at any restaurants are supposed to be wearing masks.
And if they aren't,
Those complaints will be issued to us. When we receive a complaint about a food establishment, we write an official letter letting them know that they are not in compliance with the governor's executive order.
okay,
So I noticed on page 3 that vision and hearing are way behind.
Yes, sir. Vision and hearing takes place in schools.
Yeah,
And because of the pandemic, starting spring semester, we were not going into schools. We're hoping that in fall semester, we have not gone into schools to do vision and hearing tests. We're hoping in the spring semester we'll be able to, we're not sure. Just unfortunately, because of the pandemic, we're not able to go into schools because that could be a potential exposure to the children and to our staff, so.
but under school health services, it has a fairly comparable number from the previous year. School health services.
Forgive me, I'm not entirely familiar what that metric means. I will note that we are still in 2 different school districts. We contract in 2 different school districts and have a nurse pretty much permanently stationed there for so many days a week. So we are still in a couple of school districts, continually working. Just our vision and hearing technicians are not.
Any other questions for Mr. Cece?
Okay, if not, I'll get into the COVID report. The first page you see in your packet, first chart, is our dated cases since the start of the pandemic. The dark line from the bottom are the confirmed case. The yellow stratified line on top is the probable, both stacked on top of each other, is the sum of the total cases for that day. Our highest day would be about middle November. It's hard for me to pinpoint that exact day, but you can see where we nearly had 70 cases that day. Makes our previous large days in the early part of the year look measly. We've been trending downward, which is comforting. Not that I want to relax, but if you look at the next page, it's the same data, only zoomed into the past 2 months from November 5th through end of business day yesterday. And you can see that November was our worst month yet in terms of daily cases for COVID-19. And we are going downwards in the right direction. Since Christmas, we might be seeing a bump. I'm not officially going to say that yet. Due to Christmas gatherings, I know that in our contact tracing, we have had a number of people that we've isolated or quarantined that are either contracted or exposed to COVID because of Christmas gathering. I'm not ready to say that we're gonna see a huge spike because of that. We are seeing some cases because of that. And you'll notice 3 gaps. One would be Thanksgiving Day, one would be Christmas Day, and one would be New Year's Day. That's when we did not have our staff come into the office. That's the reason for the gaps. On the following chart, this is cumulative throughout the pandemic. Line chart that has many colors.
Terry, real quick,
Yes, sir.
how are you determining probable causes?
Probable cases. Okay,
Sorry.
that's all right. Probable case is defined as a case, someone that tested positive using testing equipment that is not officially approved by IDPH and FDA.
Details that I forgot. Thank you very much.
No problem.
So where do they get their test after this?
There's a number of local health clinics that are using this device, and it has its advantages. It's produces quicker results. It's not as accurate than a PCR test, which is the RNA of the specimen. But the RNA tests take longer.
Is that considered the rapid test when you say that?
There are a couple different types of rapid tests. Some local hospital systems are able to do rapid tests in the form of PCR testing, which is, if positive, a confirmed case, because they've been given so many test kits per week by a private entity contracted to the state. But some healthcare entities also have this other device. Forgive me for not knowing its name, but it's basically is a little cheaper to produce, and they're able to push out results faster, which is an advantage in certain situations, but the results are not as accurate, and the device has not been approved by the FDA or IDPH. So thus, we cannot call them confirmed cases. For effective purposes when it comes to isolation and quarantine, though, all the rules are just the same. So if you receive a positive test result from this machine that pushes out probables, or from a confirmed laboratory test, you still have to isolate the same amount of days. Your contacts still have to quarantine for the same amount of days. So.
Questions for Mr. Ceci on COVID?
You'll notice on the cumulative chart with the blues, the reds, the yellows, and other colors. Man, I don't know why I put this many colors in this chart. I'm sorry, I can't hardly tell them apart. If you look at the solid yellow gold line and the dotted red line that indicate remaining, as in Iroquois County remaining and total Iroquois County remaining, that has gone down significantly than where it was in November. And that's good. That's our remaining cases that are isolated or hospitalized. And if we continue to go downwards with that trend, that would be great. I will point out that we have had 52 deaths associated to COVID since the start of the pandemic in Iroquois County. The final chart you see is the same as the last chart, only zoomed into the past 3 months, so you can get a better snapshot of time. Any other questions that I can entertain before I start talking about vaccines? Yes, sir.
Eric, you're showing that our cases have reduced quite a bit. How does that compare with other counties, and what does that mean is going forward as far as us in these lockdown periods that we're involved in now? Are we going to be coming out of this pretty soon, or where are we at with that?
Unfortunately, I'm not able to predict the governor's office's decisions on tier 3 mitigations, whether or not we can go back to tier 2 mitigations. I know that a number of metrics we have met in order to go back to tier 2 mitigations. Currently, we are in tier 3. I believe the governor's office was waiting until after the holidays to get through that before they lifted the tier 3 mitigations. Illinois has been going downwards. The tier 3 mitigations that were imposed right before or after Thanksgiving have been working, just as stay-at-home orders worked. Whether or not there's a large conversation I know about the illegal, the red water laws. Point is, they were effective in reducing our daily cases. Illinois in general, our positivity rate has gone down when compared with our neighboring states, where our positivity rate is much lower. Our daily cases may be a little higher, but if you look at the population and positivity rate, how many cases are being conducted, we're moving in a positive direction. That can go bad in a hurry. It wouldn't take too much. In a couple months, people get spring fever. We don't have enough people vaccinated. That could be bad. But in short, I don't know when we lived it.
Now, we're linked together with other counties.
Sir.
Are they experiencing the same improvement or declines that we are?
I haven't checked, but I believe so, because Illinois' numbers have been going down in total. We were in November around 15,000 cases, or 10 to 15,000 cases a day. Lately, we've been under 10,000 cases. Yesterday, I think we were 4,000 daily cases. So Illinois is moving in the right direction in terms of daily cases, and continue that to be great.
As you know, there's a lot of people in this county that are very interested in knowing when we can move them back into more freedom in our operations.
Yes, sir, me too. Any other questions before I move into COVID-19 vaccinations? Okay, we received 2 shipments. One was Pfizer. We received what we thought was 200 doses, ended up being 237, and we issued those within the first 3 days of receiving them, which is good because at the temperature we received it, we needed to push it out within 5 days after receiving it. After that, we received 600 doses of Moderna vaccine, which is a little more shelf stable. Basically, we can handle it in the freezer technology that we currently have. We're able to store it for a longer period of time. And we pushed out around 300 doses of that. So we pushed out about 537 first-round doses of COVID-19 vaccine. And we'll be doing more vaccinations this week. There are phases to how we're rolling this out, and we're following Illinois' mass vaccination plan on this. They came out with a new version yesterday. I read it last night. There's a few minor changes. First, we focused on what they're called Phase 1A, hospital settings and frontline medical workers that are obviously exposed to COVID-19 patients or likely COVID-19 or PUIs, persons under investigation for COVID-19. So that was our first spot. Then we focused on other healthcare workers, dentists, eye doctors, medical clinics across the county. Then we focused on first responders, EMS, EMTs, fire departments, law enforcement, and now we've expanded a little bit past that. We've started vaccinating schools, that is staff and faculty in schools, and we're going to continue doing that this week. All vaccinations are happening at one location, and we coordinate with that with agencies or departments or whatever entity we're working with. The people will get there, we schedule them appointments, and come get their vaccine. We'll be doing second round or second dose for the Pfizer on Thursday for people that received the very first shots. So we're progressing, and actually we're ahead of a lot of areas of the state, just because we had less people take the vaccine than what we initially thought would. And everything about the COVID-19 vaccine is voluntary. So we were able to move a little bit farther in Illinois' phases. We're in phase 1B, and some other counties are not. A lot of counties are not. So the state, and I understand this, the state wants to keep the whole state, all the counties kind of on the same level, same tier, and that makes sense when you're talking about mitigating COVID-19 on the whole state level. So we'll keep coordinating with the state on that to logistically coordinate our future vaccine disbursements. Any questions about the COVID-19 vaccines?
I've had several questions. Is there a cost?
There is no cost.
And that's what I didn't tell them, but I wanted to make sure there is no cost.
we are allowed to charge basically an administrative fee. And that was discussed, and it was determined that we want 0 barriers to getting this vaccine. So a person doesn't have health insurance, person doesn't have the funds, whatever reason may be, just logistically, administratively, it's easier too. So no cost. Yes.
What are the side effects and how long after the shot do they occur? And what about long-term?
Don't know about long-term side effects. Common short-term side effects include lots of different types of side effects that you see with most vaccines. Arm soreness, headache, perhaps a slight fever, a few things like that, without the vaccine information seen in front of me. Those are the most common ones that I go off the top of my head. There are some cases where people have an allergic response. More often than not, these are people that have an anaphylactic response to other vaccines as well. So it's really not all that surprising. Long-term effects, in terms of side effects, not aware of any. Do you have questions about any particular type of side effects? May jog my memory.
What is in the vaccine?
Oh, should have brought those information sheets for me. They list the exact ingredients. But I will tell you that both of these vaccines, Pfizer and Moderna, are what are called mRNA vaccines, or messenger RNA. This is not a new technology, but the first time it's been utilized. Usually vaccines are a live or a dead virus that's injected into you. Your body absorbs that, figures out how to fight it off in the future, and learns. This is not an RNA strand of the antigen that your body needs to create to fight off the coronavirus. Your body absorbs it through a molecule, and it then learns how to create this antigen without the person receiving the vaccine ever being exposed, dead or live virus, to the coronavirus. So it's a bit different and new. Yes, sir.
When do you feel you'll be able to start administering these to the general public?
Very good question. In fact, staff at the front desk yelled at me this morning because they've been getting so many phone calls per day. They're having a hard time doing their other jobs, just fielding that exact same question. The short answer is we don't know, because it's a supply issue. Pfizer and Moderna are supplying the entire country and cranking out vaccines as they can. We don't know how much vaccine we're going to receive week to week, nor do we know how many in the groups that we need to hit first will be willing to receive the vaccine. Because of that, I don't have a good estimate on when we'll be able to start vaccinating the general public. I will say that in terms of general public, we're going to target people that are 75 and older first. That's because due to the ACIP guidance and also the new version 4 of IDPH's mass vaccination plan, it says in phase 1B, later on in 1B, we're not there yet, target people that are 75 years and older. After that, 65 and older, and or people that have high comorbidities from 18 up to 65. After that, then we'll get into really general public, 16 to 65 or anybody else that wants to get the vaccine. When we reach these phases, when it's available to certain sections of the general public, we'll be doing lots of press releases about this and as much PR as we can to try to communicate that to the public. About where, how, when. There's also a question of who will have the vaccine to disperse at that point in time. Right now, allocations are being given directed to local public health departments. And long term, CDC and IDPH would like to see vaccines eventually be given to medical clinics and pharmacies, so it's more accessible to people. Don't have no idea when that will be though.
What is the temperature that when it has to be kept, and how long is it a viable vaccination when it's kept at that temperature?
Pfizer needs to be kept between -80 and -60 degrees Celsius for about 6 months of storage time. When it falls above that temperature, raises above that temperature, excuse me, we can keep it at 2 to 8 degrees Celsius, which is the temperature of a normal vaccine refrigerator, for 5 days. Moderna can be held, I believe, at -20 degrees Celsius, which is the temperature of a normal vaccine freezer, which we have for, I believe, at least 6 months. It can be held in refrigerator temperatures 2 to 8 degrees Celsius for 30 days. We do have a dry ice maker, and dry ice is colder than
Yeah.
H2O in frozen form. So if we were to ever receive a full shipment of Pfizer vaccine, which would come in a minimum order size of 975 doses, we'd be able to recharge Pfizer's thermal box they would ship it in with dry ice and keep that at the -60 to -80 degrees Celsius for 30 days. We'd just have to recharge that with dry ice every 5 days. The problem with that is, in order to receive the thermal box shipper from Pfizer, you need to put in a full order, 975 doses. And very few health departments even have that opportunity right now in Illinois, really big cities, and they have a ultra cold freezer, which we do not.
Any other questions?
Sir?
Does the vaccine only provide immunity or protection from the COVID virus?
Are you looking for protection from something else?
Just asking the question. There are other benefits to it.
I believe this vaccine is only for COVID-19, or the SARS-CoV-2 virus. There has been a lot of questions about if it's effective against this new strain that came out of the UK. All information indicates that it is still effective against that strain as well. We'd like to give a shout out to Iroquois Memorial Hospital. They've been administering our vaccine for us, and it's been highly appreciated. This being a new vaccine, this allows an additional safety net should someone have an anaphylactic response. They're already at the hospital, and they've been really great to work with.
All right. Thank you, Eric. All right, let's move on. Is there any old business? Any new business? We have a motion to adjourn. Second. All in favor, say aye.
Aye.
Opposed? And we are adjourned.
Eric, you were saying the pharmacies aren't getting the doses? I'm getting a dose today from CVS.
Well,
So does that come from somewhere else?